Hi viewers, I am Dr. D. Malleswara Rao, Consultant Interventional Cardiologist, Axcure Medcity Hospital, Hyderabad. Topic for today discussion is Atl Fibrillation. Atl Fibrillation is a disorder of heart rhythm. It accounts for 35% of arrhythmia related hospitalization. Arrhythmia is nothing but any disturbance in the normal rhythm of the heart, either change in the heart rate or change in the rhythm of the heart. Normally, heart will have a rhythm that is called normal sinus rhythm. So in normal sinus rhythm, upper two chambers of the heart beat first, followed by beating of the lower two chambers of the heart. So this is normal sinus rhythm. In this, upper chambers beat first, followed by lower chambers, and they beat in a sequential manner, and they beat regularly at an interval of around 60 to 100 beats per minute. Coming to atrial fibrillation, the upper chambers will beat at a faster heart rate at around 300 to 600 per minute, unlike a normal heart where it beats around 60 to 100. In atrial fibrillation, because of such a high heart rate, all those 300 to 600 beats won't be conducted to lower chambers. Only some of them are conducted, and lower chambers will beat at a rate of around 100 to 200. And there is no coordination between the upper chambers and lower chambers, and the regularity is also not maintained. So in atrial fibrillation, the upper chambers won't generate that much of force as the heart rate is very high. They just twitches and they just move like they just wiggle. So atrial fibrillation is a disturbance in the rhythm of the heart where there is a irregular beating of the heart. So atrial fibrillation can cause symptoms ranging from simple palpitations to causing heart failure. In one study, it is found that around 25% of the atrial fibrillation patients won't have any symptoms. They don't have any symptoms, and they found to have atrial fibrillation on routine examination. Remaining 75% of patients may complain of palpitations. So palpitation is nothing but abnormal awareness of their own heartbeat. They will complain that their heart is racing, their heart is pounding, their heartbeat is missing, or their heartbeat is beating very fast. Some patients with atrial fibrillation may complain of lightheadedness, dizziness, or giddiness. Rarely they can have a syncopal attack also. Some patients with atrial fibrillation present directly with brain stroke, and they found to have atrial fibrillation for the first time while they are getting treatment for the brain stroke. The most common causes of atrial fibrillation are high blood pressure and blocks in the blood vessels supplying the heart. And few more causes of the atrial fibrillation are thyroid problems, diabetes, heart failure, and disorders of the heart muscle, and infections of the heart like infective endocarditis. All these can cause atrial fibrillation. Atrial fibrillation will be suspected by a clinician or a treating doctor or a cardiologist by just examining the pulse. They will feel the irregularity in their pulse, so they will advise a test called ECG where your heart rhythm will be studied. So atrial fibrillation can be best diagnosed by a simple ECG test. So main dreaded complication associated with atrial fibrillation is the embolization. As we already discussed, because upper chambers of the heart are not at all contracting vigorously in atrial fibrillation, there is chances of stasis of blood in the upper chambers, and there are chances of formation of blood clots in the upper chambers. These clots detach from the upper chambers, they can travel and they can lodge into brain or lower limbs. This is called embolization, and they will cause brain stroke or gangrene of the limbs. And other complications with atrial fibrillation is it can cause your heart to fail. Your heart may not pump properly, and you may land up in disease called heart failure where you will feel a lot of breathlessness. Yes, atrial fibrillation can be treated in many ways. It all depends upon the how emergency the patient is. The patient is very sick and his blood pressure is very low. We have to convert the atrial fibrillation into normal sinus rhythm by giving an electric shock. When the patient blood pressure is normal, so we can convert the atrial fibrillation by taking time and evaluating the patient with 2D echogram and echogram done through esophagus, that is called TEE. So we will evaluate and we will decide the patient whether to convert the atrial fibrillation into normal sinus rhythm or keep the patient in atrial fibrillation but maintain the heart rate to less than 100. So this is called rate control strategy of atrial fibrillation, where atrial fibrillation won't be converted into normal sinus rhythm, but the rate of ventricular ventricle will be decreased to less than 100 from more than 100. Whereas it is a rhythm strategy where atrial fibrillation will be converted completely into normal sinus rhythm. This rhythm can be converted either by electric shock or by drugs. So those drugs are called pharmacological cardioversion. As we already discussed, atrial fibrillation is most common in the elderly population, and its incidence is around 2% in individuals more than 80 years, whereas it is less than 0.1% in individuals less than 40 years. That means risk will increases by more than 10 times as age of the patient increases. So there are certain ways by which we can reduce the risk of atrial fibrillation. As we already discussed, high blood pressure is the most common cause of atrial fibrillation. So everybody should keep their blood pressure under control to reduce the risk of having atrial fibrillation. Similarly, coronary artery disease, that is blockages in the coronary arteries that supplies our heart, is the second most common cause of atrial fibrillation. So lifestyle changes such as taking heart healthy diet, quitting smoking, avoiding alcohol, doing regular exercises, keeping your stress levels normal, all these things will prevent you having blocks in your heart. Indirectly they will keep you free from development of atrial fibrillation.